Hello, Daniel. I'm going to assess one of your letters now and provide the feedback.
Okay.
Firstly, you have written down the addressee's contact details on the top. I'm happy with that. And there is no spelling mistake. So that's good. And then you have written down the date here. The date format could have been written down in a different way. I mean, instead of writing down 22 slash, you can use maybe, 22 hyphen, you can use 22 slash. It is just the recommendation only. Okay, so
Yeah.
instead of writing down 22 hyphen August and what's the year, sorry, it's 2015. Okay, 2015. Instead of that you could say 22 space August 2015, or you can use like this 22/08, isn't it? I think A, and then 2015. Okay, this first format is preferred, but that the second one is also acceptable. All
Okay.
right. It's not a mistake, but it is a recommendation only. Regarding Mrs. Adela Barta, date of birth 27/25/7/1990. That's good. I'm happy with that. Dr. Becker, where is dear? Dear has gone. You didn't
Over
write
here.
dear Dr. Becker. Okay, Dr. Becker, that's wrong. You should say dear Dr. Becker, comma. Okay. Please proofread your letter. Proofreading saves a lot of efforts. Okay, it can help you out to improve your writing score, say from C plus to B grade easily. At least 10 or 20 marks can be obtained if you do proofreading. At least I said, depending on the number of mistakes that you commit. All right. I'm writing to you in regard of. In regard never ever goes with the of. In regard always goes with the to. Okay, so in regard of, that is wrong. It is in regards to. Okay, otherwise if you have confusion with this, you can use just simply regarding. That's it. Very simple. I mean, there is no need to add regarding to something. Okay, so it's regarding. That's it. I'm writing to you in regard to.
That
Regards to.
I'm writing to you in regard. So
To,
what should
in
I write?
regards to. In regards
In
to.
to.
It should be
Okay.
regards, and then this one is off, must be replaced with the to, to.
Okay.
Look at this, please. Look at this.
Re-
In regards to. So this needs to be replaced with in regards to, or you can write down simply regarding. Sorry,
okay.
regarding. I'm writing to you regarding Mrs. Bata, a 30 years old lady. That's wrong. We will use whenever we have to describe. We will say 30 hyphen years old here. But when you have to write down in a complete sentence, this is wrong because you're writing down a lady after that. So this noun, okay, sorry, this article is going to be in relation with this lady, which means you have to say a 30-year-old lady. It's not 30 years old lady. Do you understand what I mean? It's not 30 years old, but 30-year-old. So you should
Okay.
say 30 hyphen year hyphen old and then lady. All right, let's go to the next one. To review the
Oh,
prescriptions,
yeah.
to review the
Okay.
prescription. Okay, I'm writing to you. Okay, in regards to Mrs. Bata, 30-year-old lady. There should be a comma here. Okay, after lady,
Okay.
30-year-old
We have,
lady, you should place a comma
uh. So we have to
because you are
do we have?
defining it.
Okay.
You are giving additional information here. Okay. Okay, and then you're saying to review the prescription. No, no, no. So you are requesting, this sentence is incorrect. What you should have done is you should have written down, I'm writing to request you to review the prescription of Mrs. Bata, a 30-year-old lady. Do you understand what I mean? I mean, what you should have done, the first sentence should have been written down like this. I'm writing this letter to request you. Otherwise, you can simply say, I'm writing to request you. Okay, that is also fine. I'm writing to request you. I'm writing to request you to review the prescriptions of Mrs. Bata, a 30-year old lady. Sorry, lady. Yeah. Write first sentence like this, because you can't say to review something. This is incomplete. Okay, I'm writing to you in regards to dash, and then to review the prescription. That is wrong. Okay. And as she was suffering from. Okay, is that a comma or a full stop? After prescription, I can see a full stop. Can you see that?
Also, no, it's I did give the prescription as she. No, it's not comma. It's not full stop. It's nothing.
But I can see something in here, isn't it? You can also see that, right?
Mm.
Can you see something here? It's a kind of full stop. Yeah, it looks like. Okay, so then if that's an issue, then yeah, that's, you shouldn't write down that. Okay, as she was suffering from, conjunctivitis, and now she is diagnosed with the urinary tract infection and needs medicine. Do not write down a longer sentence using several and in between. It doesn't look good. Try to split it here itself. Okay, as she was suffering from conjunctivitis. Okay, so why are you writing down conjunctivitis and urinary tract infection? So was the medication, the prescription medication previously, only for the conjunctivitis, the existing condition? Am I right?
No, it's for the urinary tract infection.
So this, okay, then why are you writing down conjunctivitis here? So you need to
Uh,
request the review of the prescription, because she is diagnosed with the urinary tract infection. Am I correct or not?
can you please give me 1 minute?
Yeah, that's all right. Yep, no worries.
Okay, just give me 1 minute.
Yeah, that's okay. So as she was suffering from conjunctivitis. Okay, so what I'm gonna do is I'm gonna, as she was suffering from conjunctivitis. It's not conjunctivitis, it's just conjunctivitis. Okay, conjunctivitis. All right, remove this phrase, please. You have to remove this phrase. That's the first thing. And then conjunctivitis and now. Okay, as she was suffering from, sorry, it's not she is suffering from, as she was suffering from, instead of that, what you should have done is a 30-year-old lady, as she is diagnosed with. Okay, and now she is, and now could have been replaced with as, and then she is diagnosed with the urinary tract infection and requires medicines as soon as possible. Okay, as can be used instead of writing down and now, you could have written down as she is diagnosed with the urinary tract infection, and then you could have put a full stop here, and needs. Okay, and needs, again, you should have said, you should have started a new sentence. She requires. Okay, try not to use needs. So needs is an informal phrase. It's not good. We have to use the formal phrase only as much as we can. And then as soon as possible, that's good. Except these mistakes, the introduction paragraph is okay. Mrs. Barta was initially complaining about dry eyes. Okay, initially complaining about dry eyes, for which there should be a comma. For which, okay, there should be a comma. For which, comma. Are you there, Daniel?
Yes, I'm here.
Okay, so for the introduction paragraph, there are a couple of mistakes. Okay, do not write down this longer sentence. Okay, the first one is really long. If you feel that you commit mistakes, it is okay to like write it down in this way. I'm writing to request you to review the prescription of Mrs. Bartha, a 30-year-old lady, as she. You can use this one as she requires, and then you can, okay, for example, I'll tell you this. So the whole sentence can be written on like this: I am writing to request. I'm writing to request you to review the prescription of Mrs. Bata, comma, a 30-year-old lady, comma, as she is diagnosed with urinary tract infection, which means as she was suffering from can be removed, from here to here. Okay. And then and now can also be removed. So remove from she was suffering from conjunctivitis to until now. Okay, then it's good. As she is diagnosed with the urinary tract infection. Okay, and put a full stop here. And then write down a new sentence like she requires medicine as soon as possible. Okay, so you'll write down a new sentence.
Okay.
Mhm.
Okay. Let me write again. I should write that I am writing to you to review the prescription.
I'm writing to you to request. Look at this one.
Okay.
I'm writing to request. You can say, I'm writing to request you to review the prescription of Mrs. Bata, a 30-year-old lady. And then there should be a comma. You shouldn't finish it. You have to say, as. Okay, do you understand this one, this first part? You just write down like this. Anyway, you're going to get this one, isn't it? I'll
Yes. Yes.
write it
Yes.
down once again. Okay, so maybe I'll write down the whole sentence so that it'll be easy for you. All right, I'm writing to request you to review the prescription of Mr. Bata, a 30-year-old lady, as she is diagnosed with the what do you call, what is that? Urinary tract infection. Okay, urinary tract infection. Is that the one? Yeah, that's right. Urinary tract infection. She's urinary tract infection. She requires the appropriate. You can use them. I mean, like you can elaborate it. Otherwise, you can mention she requires medicine as soon as possible. Okay, that is also fine. That's fine.
Yeah.
So write.
Have you read the letter? Sorry, the case notes.
No, no, we'll go through that. Yeah, why not? We'll go through that.
Okay.
Yeah, but the thing is that I just would like to know whether this is the correct introduction. So, is this the problem she is facing for which you need the prescription? I'm asking you the question. Is that right?
No, actually, in the case notes, it was written about all the history that
Mm-hmm.
she started the problem with the eyes, and then she step by step she just diagnosed with the conjunctivitis, and for that she took the medicines.
Yep.
So she was having an allergy from one of the antibiotics. So now she has developed the urinary tract infection, as doctor has advised him the same antibiotic which
Mm.
from which she already have been getting
Become
allergy.
allergic. Yeah, that's then it's correct. It's good because the current see, you are requesting the doctor to review the prescription because of the problem. This problem she is receiving, isn't it? She is experiencing this particular problem. Urinary tract infection because of the existing prescription medications. Is that right? So she has been taking the existing prescriptions, and as a result, she has got this particular problem. And now you need to request the doctor, hello doctor, please change the prescription because she has been becoming allergic to this, all right, to the existing medication. So can you please provide the other medicines that
Or
can be
shall
suitable?
no or should I write in the introduction about that she is allergic to that antibiotic?
Yeah, you can also mention that, yes, she is now okay, what you could have done is that you could have mentioned in this sentence, as she has become allergic to the existing medications,
No, not existing.
then
The doctor just gave her medicine for the conjunctivitis, which
yeah, as
she
she has
got
become okay.
allergy. Yeah,
Hmm.
she got allergy, and then the doctor changed to another one. But now, when she developed, in after 1 year, she developed urinary tract infection,
Hmm.
and by chance, the doctor gave him the same that antibiotic.
Hmm. Okay.
So yeah, so she has not started that antibiotic. just when she came to the pharmacy, the pharmacist looked that it's the same antibiotic. She might have allergy to them.
Ah,
That's
okay.
why
So
the
she will,
yes,
okay. So she has already shown allergic reactions to the same tablet, right? Same antibiotic,
yeah, in
right?
the past. Yeah, in the
In the
past.
past. Okay. So you can mention, so she has become allergic to the same medication. Is that the medication or the antibiotics? Is that different?
Same.
Okay. All right. As the same medication, she requires maybe different medicines. Is that right? Is that what you're saying? Or
Yes,
maybe you
she
can
requires
say
different
she
medicine.
requires um, a more
Yes,
appropriate medicine. We can say that, isn't it? More appropriate
yes.
medicine. Is it going to be only one medicine, or do you need a bunch of medicines?
No, 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 no. Only one.
Okay, yes. Then you can say maybe a more appropriate medicine as soon as possible, or you can say maybe less harmful medicine. Okay, or I think
Yes.
more appropriate is okay, as soon as possible. Write like this. This is good. Okay, I'm writing to request you to review the prescriptions of. So the doctor is going to review the medicines and then provide a new medicine. Okay, because she has become allergic to the same medication in the past. You can also mention this. Okay, in the past. Okay, that's good, like this. Okay, as she has become allergic to the same medicine in the past, or as she was allergic. Okay, that is also fine. You can write whatever the things, as she was allergic to the same medicine in the indication in the past, she requires a more appropriate medicine. Otherwise you can say she requires a less harmful medicine, or she requires a medicine with the less side effects. Do you know what I mean? Something like that. So yeah,
Mm.
this one is good. I'm happy with the way that we have written on this sentence. Okay, let's go through the next one. Mrs. Barta was initially complaining about dry eyes for which there should be a comma. She had been prescribed, carboxy, whatever, like methyl, cellulose, sodium, but after few days there should be a comma here. So, but after few days, okay, you should have mentioned after a few days there should be a comma, okay. After a few days, okay, she diagnosed with, okay, it's not she diagnosed with, she was diagnosed with again. Okay, she diagnosed with, that's wrong. You should say she was diagnosed with. All right, try not to write down so longer sentences. Okay, if you feel problems with the grammar, but this one is okay. Apart from those silly mistakes, like after a few days you need to place a comma, for which you need to place a comma, and then she was diagnosed with. Okay, that's the thing. Okay, conjunctivitis, that's a full stop, right? Isn't it?
Yes.
You said optometrist, that's wrong. You should say an optometrist.
Oh, yes. I know.
Remember that all occupations need an article before them. Okay, all occupations, whatever it is, it could be either a or an or the. I mean, one of them must be used. Okay, right. An optometrist issued her sulfoxetine, okay, whatever it is, that's the medicine name, that's good, per ml, due to which she developed. Okay, it should be due to which, again there should be a comma. Due to which there should be a comma. Okay, due to which she developed itching and burning, which might be the non-compliance, probably. No, which might be the non-compliance, or probably the allergy to okay, whatever the medicines. Okay, as a consequence she has been prescribed the Zillet 20 ml. You don't need to use the Zillet, isn't it? As a consequence, you can say Zillet 20 ml has been prescribed, instead of writing down she has been prescribed. Do you understand? I
Okay.
mean, this can go in place of she. As a consequence, Zilex 20 ml or Zillet 20 ml has been prescribed. That's it. Okay. You don't need to use the Zillet 20 ml. Okay.
रोने दिन पे
Remove the. Okay. The is not needed. And move Zillet 20 ml replacing she. Okay, so it's going to
Okay.
replace
Uh,
Zillet 20 ml here.
okay. So
Right?
now it has become as a. Oh, sorry.
Consequence, as a consequence, Zillet 20 ml has been prescribed. Put a full stop. That's it. As a consequence, comma, Zillet 20 ml has been prescribed. Is that clear? Is it clear? Hello?
Hello. There was a issue with the network.
Okay.
Yo.
As a consequence, Zillet 20 ml has been prescribed.
Yes, I got it now.
Okay, for sprain in her right hand's index finger, finger splint had advised. No, finger splint was advised. It's not had
Okay.
advised. It's what was advised. Sorry. Okay, let's go to the next one. As Mrs. Barta is having urinary tract infection, seems to be the capital U. Can you please write down the small u? Urinary infection, tract infection, and she has been prescribed
So I need
Bactrim.
to write it capital.
Small u, but you are writing down capital U, isn't it here? Write
Okay.
down
Okay. So
small
I
u.
need to. Okay.
Yeah, and she has been prescribed, which is Sappho methods. I'm concerned about the allergies she previously went through. Okay, she previously went through. Okay, all right. As she has been having infection and she has been prescribed Bactrim, which is I'm really concerned. Did you place a comma here after this medication? Trimethoprim. There should be a comma.
Yes.
There should be a comma, but you didn't place comma, right?
Yes.
Place a comma after what is that medicine name? Sorry, medicine's name. Trimethoprim. Trimethoprim. Okay, all right. Trimethoprim. Okay, place a comma after trimethoprim. Okay, and before I am concerned. So I'm concerned about the allergies she previously went through. That's okay. After come to know, after coming to know, after come to know, after come to know, after knowing. You can use after knowing or after coming to know, but after coming to know is not formal. So it's better to know, better to say after knowing about the possible allergy and waiting for any alternative to be prescribed, she is not happy. So you said you want to say that after knowing the possible allergy and waiting for any alternative. Why? What's the thing like, waiting? I couldn't understand this. So does the patient need to wait for getting the alternative medicine
Yes.
for some time, or like can't she get the medicine like immediately in the next say 5 minutes or 2 minutes or so on? She can't go back to
No,
the doctor.
no, because doctor has just prescribed, and after come to know that she's allergic. So now
It's not,
I'm
then it's
writing
not
to
waiting
doctor.
actually. Then it must be wait.
Okay.
Okay. So wait for any other alternative to be prescribed. There should be a comma. After prescribed, there should be a comma. Prescribed. Okay. Place a comma here. You need to place a comma after that. Okay. All right. I would like you to prescribe her different antibiotics as she needs it on urgent basis. Okay, she needs it. She needs it. No, never ever use she needs it. As she requires it on urgent basis. On an urgent basis. On urgent basis. On an urgent basis. On an urgent basis. Okay, that's what you gotta do. All right. I tried to phone you. No, I tried to contact you. Try not to use. I tried to. I tried to phone you. I tried to contact you. All right. I tried to contact you. All right, let's say I tried to contact you, but unfortunately there should be a comma. You were not available. After unfortunately, place a comma. Unfortunately, okay, place a comma here. After that, you have to place a comma. After unfortunately, there should be a comma. You were not available. It would be appreciated if you could do it. If you could do it. If you could do it. Where is the second page? If you could do it as soon as possible. But you didn't say if you could do it. Yeah, as soon as possible. That's good. If you have any questions or queries, okay, try not to use our queries. Just use only questions. Please do not hesitate to contact me. Do not must be okay. So let's say our queries. Remove this whole phrase. Okay. Do not. You have written down like a single word, but it has two words. You should say do and then not. Do not hesitate to ask me. It's not ask me. Try not to use the informal phrases. It's not good. Yours faithfully, that's all right. The pharmacist, Newton pharmacy, that's good. Everything else is all right. Let me have a look at the case notes. So you are a pharmacist, Newton pharmacy, that's okay. That's fine. Date of birth is okay. Address is all right. Married husband, Mr. Alexander Barta, works school teacher. That's not needed. If the GP already knows, you don't need to mention that. First visit to okay. Solution with dry ice. Fill up 10 drops. That's okay. These are the past ones. You don't need to mention anything about that unless the recent one where they have got some problems. Finger splint. That's okay. That's all right. Where is that allergy? There is an allergy, isn't it? For conjunctivitis, okay. Zillet, all right. That's okay. You don't need to include this one and this one. The first two visits, they're not appropriate. But for the remaining ones, yes, general practitioner, GP, Dr. Klaus Becker, optometrist, okay, physiotherapist, all right. Allergies, no known allergies, that's okay. Let's go to the next one. Client presented with the symptoms of dry eyes, possibly due to overuse of computer. Okay. And that here sensors regular tests, risks of looking at a computer screen. Okay, all right, and then client presented with the conjunctivitis, client returned, no improvement. It's increased. That's all right. That's okay. That's fine. Actor interest level. That's okay. The GP suggests different antibiotics. Okay, GP not currently available on the phone. Okay. The previous reaction. Okay, that's good. Okay, client not happy about waiting. Okay. The patient when new medicine is available to collect. Stress in letter. The client wants response as soon as possible. Yeah. Okay. Okay, so you can also mention this one as well. I'll advise the client. I mean, I'll advise Mrs. Bartha when the medicine is available. So you have to mention that as well.
Sorry, what should I write?
This one. Can you see this one?
What should I write?
Will advise. Okay, you should say I will
Yes.
advise. I will advise, or I will contact Mrs. Bartha when new prescription is available, when new medicines are available, when the new medicine is available. So this one needs to be written down. Okay. Using the information provided in the case notes, doctor suggesting the review of prescription and detailing the client's relevant medication history. Yes, that's right. You have included this. Good. All right. Class backup. Yeah, that's good. Yes. You have included all the relevant case notes except this one. So this one should have been included as well. But apart from that, I think everything else is all right.
But I want to ask you one question that there has been the history has shown in the dates. So do we need to mention the dates in the letter as well?
You don't need to. I mean, like you can just you don't need to mention like about but you can say about a year ago or about a month ago and so on. Okay.
Okay, one more thing that in the letter they have not told us that which date we should mention in initially in the start of the letter where we write the.
Maybe you can mention if there are different years, you can say about a couple of years ago, initially a couple of years
No,
ago,
no,
something like
I'm
that.
just asking that in the start.
Mm-hmm.
of the letter where we put the date, like Dr. Claus Baker, Newtown Medical Clinic, 72 Main Street, Newtown. After that,
Yeah.
we have written 22 August 2015. So that
Yep.
date was not mentioned in the notes anywhere, but that date is the date which is the last when she come.
Okay.
Yeah,
Okay. So yeah, yeah. If
the
that is
reason
not mentioned,
why.
also that was the recent one. Is that what you're saying? Is that the recent one? Recent visit?
Yeah, it was the date of the recent one visits, because
Yeah.
where the
Hmm.
visits are
Hmm.
mentioned, it was the
Mm-hmm.
recent one, so that's why I put that date. So is it okay?
Yeah, that is correct. That is the latest one. Yeah, that's what you have to do. Yes, you're right.
Okay.
It's better to use, what you can say, the formal words and formal synonyms, and spelling is another issue. Okay,
Okay.
spelling is another issue. Overall task fulfillment is okay, but that could have been somewhat better. Okay, all right. Presentation features and layout are fine. I'm happy with the way that you have been organizing the letter. So the organization of letter is okay, but the problem is that you're not using passive voice, you're not placing the punctuation marks properly, and then some of the sentences are incomplete as well. Some sentences are incomplete and incorrect, as I already told you. Okay, and then the introduction paragraph, for example, it needs to be completely rewritten. Okay, passive voice form should be used frequently. All right. Yeah, apart from this, everything else is all right. This one has got, according to me, you have committed many mistakes in this case. This is not good, and most of the mistakes are unfortunately the major ones. Okay, please, try to proofread it, okay, before you send it out to me. For this one, I can give you perhaps 250 out of 500. Unfortunately, you can get C grade only for this letter because of so many mistakes. Okay.